Okay, well, good morning, everyone. This morning I'm joined by the Deputy Premier, Paul Toolo, the Health Minister, Brad Hazzard, Chief Health Officer, Dr. Kerry Chant, and the Deputy Secretary of New South Wales Health, Susan Pearce. Can I begin by just reflecting on this horrific tragedy that occurred yesterday, the shark attack? Can I say to the victim's family and friends, we extend our deepest condolences and sympathies. Our thoughts and prayers and hearts are with you at this difficult time. It's a reminder, I guess, to us all of the fragility of life. Can I also say to people right across our state that we have closed a number of beaches on the advice of the Department of Primary Industries and New South Wales Police. And can I say to everybody, please follow those instructions. If beaches are closed, please do not go in. Please stay safe. I can also advise that surveillance is underway at the moment, tracking the shark down. I just want to make it very clear to people right across our state, follow the instructions of lifeguards and surf lifesavers who are out there at beaches across the east, but more particularly, if beaches are closed, please do not go in. Today, we're making a number of changes in relation to restrictions across New South Wales, and we are able to lift these restrictions based on the efforts that people have made right across the state. And I know it's been a very difficult 2 years here in our state. Many people have made enormous sacrifices, but the efforts that have been made in relation to being vaccinated, a 95% vaccination rate, as well as boosters, and Susan Pearce will provide some information in relation to the uptake of boosters in New South Wales, but that's ensured. We've had downward pressure on our hospital system. We've said as we've moved through this phase, the key metric for us has been hospitalisations and ICUs. There are very pleasing signs in our hospitals at the moment right across our state. So as a result today, as a result of those substantial efforts that people have made, we'll be easing a range of restrictions across our state. So beginning from tomorrow, the 18th of February, the following adjustments will be made to settings across our state. The 2 square metre density limit will be removed. QR check-ins will only be required for nightclubs and all music festivals with more than 1,000 people. Hospital, aids and disability facilities may use their existing systems that they have in place, and we know there are different measures in those settings, but they will remain in place. Singing and dancing will be permitted at all venues except music festivals, where singing and dancing will recommence from the 25th of February. And as of tomorrow as well, the recommendation of working from home will change and be returned to the employer's discretion. In addition to that, from next Friday, the 25th of February, the following adjustments will also be made. Masks will only be mandated on public transport, planes and indoors at airports, hospitals, aged and disability care facilities, correction facilities and indoor music festivals with more than 1,000 people. Masks will continue to be encouraged at indoor settings where it cannot be maintained a safe distance from others, and as well as that, customer-facing retail to protect vulnerable people who may need to access these premises and services. The 20,000 person cap on music festivals will also be removed, with singing and dancing permitted. In relation to returning to work, we understand as well that face masks are obviously a substantive impediment for people returning to the office. That change will come in next week, but as of this week, being tomorrow, we'll be removing the requirement to work from home if you can. And here in New South Wales, we'll be working with our public service over the course of the next week as we move to that period of time. And our expectation is that employers across our state will also follow that direction and work very closely with their employees. A lot of that came out of the Sydney Summit that we held last week, but these changes today are measured and proportionate to the circumstance we find ourselves in, and are particularly due, can I say, to the effort of everybody across our state. In addition, can I say today that hotel quarantine for unvaccinated travellers will be reduced from 14 days to 7 days. And Susan Pearce will also provide further information in relation to the return of non-urgent elective surgery. We obviously from the outset brought non-urgent elective surgery back in our regional hospitals, a number of our regional hospitals, and as well as that in our private system. We've already started working through the return of non-urgent elective surgery in our public system as well, and we will, and Susan provide further information in relation to that coming back on. And can I say that we go back a few weeks where we were sitting when we brought out those scenarios in terms of our health system and the capacity within our health system, we are tracking incredibly well. As I've said, it does not mean that our health system is not under pressure, but the efforts that people have made over an extended period of time, 2 years now, has ensured that we can be in this position today. Also make the point, and Dr. Chant will also speak to this, is what we could expect over 2022. And the reality is, as we move forward, there's the potential, the likely case, that we will have spikes in cases from time to time. But I'll make this point, as we ease restrictions here in our state from tomorrow, that from time to time we will see cases increase, at other times decrease. That is not a measure of success or failure, that is living alongside the virus. We have been saying this for a number of years now. This is the new reality. Now, as cases increase from time to time, we know that particularly as we head into the winter months, more challenges will come our way. But what is most important is that we will change settings on a proportionate basis in the circumstances that we find ourselves in. So can I finish by just thanking everybody? Today is a very important day. Many businesses across our state for 2 years have done it incredibly tough. We know that many businesses have had to close. 2 years ago, we lost 300,000 jobs in our state, and we recovered every single one of them, plus 30,000 more. So confidence will continue to build. New South Wales will continue to lead the country out of the pandemic, and we can do that because of our strong vaccination rates. I do want to make the point that we still need to get that booster rate up. We have many centres, as you know, across our state to receive a booster shot. I want to thank our nurses on the front line there who've been administering that since this pandemic vaccination program began. We need to continue to make those efforts. This pandemic is not over, and what is very clear is that vaccinations and boosters keep people safe. So the efforts that everyone has made has ensured a very strong response and ultimately ensured that we can open up safely. And that's what this is all about today. I want to thank those businesses, particularly those who have gone through a difficult time over the last 2 years. I think we can see now that the efforts that everyone has made has ensured that New South Wales is in a very strong position going forward. I want to thank them for the efforts. We also know with international travel returning that we're getting back to normal in a safe way. This is what living with the virus looks like, and we would not be here but for the efforts and many sacrifices that people have made over the last 2 years. I'm now going to pass to Dr. Kerry Chant, who will give a public health update. Susan Pearce will then speak to the return of non-urgent elective surgery and the continuation of the booster rollout in our state. The Deputy Premier will then speak to the importance of these changes today, the easing of restrictions in regional New South Wales, and then Brad Hazzard today will just take any questions that you may have.
Thank you, Premier. I know that the public health team will have given an update this morning, but I'll just touch briefly on the data from today. We've got 1,447 people in hospital, including 92 people in ICU, 47 of whom are ventilated and 3 are on ECMO. We have 9,995 positive test results, and that includes 5,747 positive rapid antigen tests and 4,248 positive PCR tests. And those PCR tests, the 4,248 positive PCR tests, were out of a total of 44,316 PCR tests. And sadly, we reported the deaths of 14 people, 10 men and 4 women. And can I pass my condolences on to the families for their losses. I would actually just like to have a bit of a talk to the community about what 2022 will look like. And I think it is important that we change our horizon of thought from the immediacy to the long term and engage in a dialogue with the community about what that will mean for them. So Omicron may be the dominant strain and its sublineages, so the cousins of Omicron as we call it, the BA2 and BA3, they may continue to be the dominant strain. But we will need to plan and prepare for the emergence of new variants. I think it's been surprised many, maybe not surprised some, at how prolific COVID has been in throwing off variants. And for a variant to get established, it needs to actually be more transmissible or escape prior immunity or vaccine immunity. So it takes a bit of effort, and COVID's certainly thrown us some examples of how it has changed, and we have to be watchful of that. We also need to consider the resurgence of influenza, flu. We haven't had a flu season for the last couple of years, but with borders open and we have seen flu come back in the Northern Hemisphere, not in a big way. And the reason for that is the measures we put in place for COVID actually protect against flu getting out of hand. So those simple things, those hygiene messages, staying at home when you work, when you're ill, wearing a mask, they're actually very effective at suppressing flu. So we have to plan for a bad flu season, but it's not inevitable that we will see one. There will likely be further waves of COVID as vaccine and infection-derived immunity wanes. We need to be clear about this. So even in the context of no new variants emerging, we can expect further waves. At the moment, we've seen a stabilisation in numbers with slowly declining hospital and ICU admissions. And as I mentioned, Omicron BA1 is the dominant strain variant, but we're also seeing indications of an increase in BA2 and need to be watchful of what that means. Going forward, we need to continue to have a very flexible and proportionate response, and we need to monitor the situation closely. We'll need to have an ongoing focus on high-risk settings that are vulnerable. And by that I mean the aged care facilities, hospitals, corrections facility, disability care settings. We know that older people and those with underlying health conditions will continue to be hit hardest by COVID in the coming years. On a positive note, and we need to be really positive, is that vaccines are effective. They've really held up against severe disease and hospitalisation. And we also have access to new antiviral therapies. We also know how COVID is spread, and we know what controls it. So we know how we can act as an individual to protect ourselves, our loved ones, but also how we have to behave to protect those most vulnerable in our communities. And I would urge the community to continue to think about those who may be more vulnerable to risk. So the things that we know work are staying at home when you're sick, a really simple thing. And we probably, regardless, even if COVID diminishes, it's probably a really good thing to stop all those respiratory infections going ahead. Good ventilation. COVID has really brought into fore the emphasis we need to have on good ventilation. And things like mask wearing. We know that they are a really good risk mitigant. It is likely that we are going to need to roll out additional doses of vaccine. It may be that is then targeted at those who are most vulnerable at severe disease, but we know that ATAGI is being very watchful of the rollout of the 4th dose in countries overseas, and is mindful of updating and frequently revising their recommendations. And so the change in terminology to up to date with vaccination is really very important for all individuals, and so the vaccination schedule that one individual has will be different from another. So it brings it into the fore of how we normally approach immunisations, with sometimes different recommendations for different groups depending on their age and their underlying health conditions. So as we progress through 2022, we need to ensure that we balance and are proportionate in our response to COVID and balance our response against the harms or other mental health and health impacts we might have. And I'm particularly keen that we work collectively with the Commonwealth on the aged sector response. I mean, clearly we understand that serial isolation of frail elderly is not a good outcome, as the Minister's previously discussed revising some of the visitor policies. So 2022 will be a year of recalibration, but I think we have to continue to expect the unexpected in terms of the emergence of new variants, and we also need to expect new waves. But I would ask all the community that even though we might move away from mandates, being proportionate and measured response, that everyone has to make their own contribution to keeping themselves, their loved ones and the broader community safe. And I am really reassured that the community has been adopting so many COVID safe measures. So thank you.
Next week it will be a full 12 months since we commenced the vaccine rollout here in New South Wales, and what a 12 months it's been for our staff on the front lines of those vaccine clinics. It's really pleasing today to know with pretty good confidence that we will hit 50% of our population above 16 today overall who've had a booster, and that's great. Almost 54% now in those eligible 16 years and above have received their booster shot, and we're really pleased to see that number climbing up each day. Of course, we want it to be much higher. And as we discussed last week, all of our vaccine centres, particularly over the next 3 weekends, are open. You can walk in there. You do not need a booking prior to arrival. Please come as a family if you want to. And as I said last week, even if it is for your first or second dose, it doesn't matter. If you've got your children who'd like to be vaccinated, come as a family, and please make that effort, particularly over those next few weeks. We've touched on the return of non-urgent elective surgery. As the Premier noted, from the 7th of February we were able to do that in a number of our regional hospitals and also in private hospitals across New South Wales. From next week, our hospitals will commence across the board the return of non-urgent elective surgery. But one thing I would like to make clear about that is that it will not occur at the same rate or the same level throughout our hospitals. We do need to be cognizant of the continuing staff furloughing associated with COVID. We have around 1,800 staff presently, so whilst it's a significant reduction, there are still a number of health staff furloughed, and we've got to take all of those factors into consideration as to how we can safely return non-urgent elective surgery in our hospitals. But what is important, and I'd like to acknowledge for those who've been waiting for their surgery longer than they would have had this not occurred, please can you know that we thank you and acknowledge that effort that you've also made. We really want to address those people who are waiting for their surgery as quickly as we possibly can, but we do need to do that in a safe way for our patients and for our staff, and we look forward to being able to increase that in the weeks and months ahead.
Well, today is exciting because today we are able to ease restrictions, and that is because of the strong response that we've seen from the community. Our community over the last 2 years has responded. They've come forward and they've got vaccinated. But I do say to people, if you haven't got your booster, please come forward and still do that. And in that way, you can ensure that you are keeping yourself, your family and your friends and your wider community safe. These restrictions being eased today are an important step. This is about making sure that we're continually striking the right balance between keeping our community safe and keeping the economy moving. Today's changes are important, and they're important for people right across regional New South Wales. We want to get back to those situations where tourists are coming into the regions. We want to get back to where we see those streets busy with people walking up and down. We want to make sure that people are getting back into the shops, seeing that buzz back in the bush. We know that country shows are wanting to happen again. We want to make sure that they're coming back bigger and better than ever before. And these restrictions being eased today are an important step in being able to deliver that. Even with masks being removed in a number of situations, isn't it going to be nice that we'll be able to see a maskless smile on people in our communities as we go forward? These restrictions are the efforts of everyone that has been working over the last 2 years, and I sincerely say to the community, thank you for the work that you have done.
Premier, can we just clarify schools? Are masks dropped in schools and classrooms? And what happens with rapid tests beyond next week?
So we're currently working on our schools plan in terms of beyond the first 4 weeks with the rapid antigen tests, and we will announce that in a comprehensive way shortly. Can I thank parents across our state who have made those efforts to provide those rapid antigen tests to their kids. I know it has been a challenge for many, but ultimately what it has done is been incredibly successful in instilling confidence in both our teachers and our parents in getting kids back to school. So at the moment we have those provisions in place in terms of masks being required in secondary school and recommended for year 3 and above, but we are working through those issues at the moment and we'll have something to say about that shortly.
If they are strapped in offices and in retail, is it given they'll go in schools as well?
Nothing is a given in life, Clinton. We're currently working through those issues. We've separated schooling out. There's a range of issues that we are looking at right now, working with the Department of Education and New South Wales Health. Obviously masks is one element, also the continuation of rapid antigen tests. We're working through those issues and we'll have something to announce shortly. So what we've said, and it's set out in our announcement today, that we want people to come back to the city in a COVID-safe way. Obviously for many public servants in New South Wales, we have many in the Parramatta CBD. What was very clear, and I think very pleasing actually from the summit last week, is that it's the private sector working with government to bring life back to our cities. We want to do that in a COVID-safe way. I note today that we have left that the requirement for a mask for next week, but what we'd like to see is employers, and that includes the public sector, and I'll be working very closely with the heads of department over the course of this week to get as many people back into the office as quickly as possible, as safely as possible. I also appreciate and understand that for many employers, having flexibility in terms of workplaces is very important too. I think it certainly helps parents, mums and dads balance the challenge and the juggle of work and family life, but ultimately as well we want people to come back to the city, support our local businesses. A number of the initiatives that came through the Sydney Summit we are considering at the moment. We know from the last 2 summits that we've held here in our state after the Alpha outbreak and the Delta outbreak that they have been incredibly successful, the suggestions that came forward and the implementation of them in terms of breathing life back to the cities. We'll continue to work with the councils, obviously the Parramatta Council and the Sydney Council, City of Sydney Council, to get things back as quickly as possible. But we should all have confidence to do that, and we can have that confidence because of the efforts that everybody has made in getting vaccinated. Susan just spoke to the pleasing increase in booster rates. If it has been 3 months since your second dose vaccination, please go and get a booster shot. And the same if it's been 4 to 6 weeks since you've had COVID, do the same as well, either at your GP, your pharmacist or at any of our centres. I know we still have on weekends in our centres across our state walk-ins available for people to come and get that booster shot. That effort, that sacrifice has ensured we're in the position we are today, which is if we take a step back here, compared to anywhere else in the world, we've had a very, in terms of a hospitalisation rate, ICU presentations and deaths, the success of that has been because of the booster shots and the vaccination program. We had during the Omicron outbreak less people in ICU than at the height of the Delta outbreak. So that's incredibly pleasing. But ultimately as well, by keeping people safe and by having that vaccination program, we're able to open up and get back to the life that we love.
Are you
Please.
prepared for hospitalisations to increase as a result of these measures changing? And are you going to hold the line and not introduce restrictions again if that does indeed happen?
Well, 2 points on that. Firstly, as I said earlier, this is what the new world looks like as the pandemic moves to an endemic phase. The reality is increases in case numbers or decreases in case numbers is not a sign of success or failure as we learn to live alongside the virus. This is what life looks like. Now, to the second part of the question, as we've said and as Dr. Chant has pointed out, we continue to monitor that. We continue to monitor, as we always have, hospitalisations and ICU numbers, and as we move through different phases, there may need to be some proportionate restrictions brought in, just as we've seen during this period of time. So, whilst it's not set and forget, we should also have significant confidence about where we sit as a state today. We've come through 3 waves of this pandemic, and at the end of all of that, our death rate is incredibly low. Our hospitalisations and ICU presentations, whilst at various points in those waves, have increased. Our health system has remained strong during a very difficult time. But, as we've seen throughout this entire pandemic, we don't know what comes around the corner. Ultimately, our role as a state is to keep people safe, keep businesses open, and keep people in work. That's what we've been successful in over the last 2 years, and we'll continue to do that as we move through 2022.
Premier, can you explain the rationale for removing the work from home recommendation tomorrow, but not having the trains returning to a full weekday timetable for another 11 days? Wouldn't it be better for those to line up more?
Well, we'll work through that, and I'll take advice from the Transport Minister. We obviously have set that date prior to these decisions being made. We wouldn't expect, we want people to come back to the office. We think that will take time for confidence to come back. We're already seeing a lot more activity, and the discussions I've had with Transport for New South Wales and the Transport Minister over the course of the last week has been that we have seen an increase in patronage. That's positive. We're also seeing, which is pretty rare to say as a good thing, more traffic on our roads as people come back to work. That's positive too. And we know that many businesses around here have been doing it incredibly tough. International borders reopening, tourists coming back is going to be a great thing for our state, but we will always monitor the timetable with Transport, and if we need to make some changes based on the decisions today, we will.
Premier, what action will you take in response to the revelations that Mick Fuller and other senior police didn't declare their shares in racehorses, including the businessman who won lucrative police contracts or became embroiled in criminal investigation? Did he and the other senior police breach the rules, and what action will the government take?
So I've already spoken to New South Wales Police about this matter, and this has already been looked at by an external agency. They've already come back and said no further action is to be taken, and any questions on this matter would need to be directed to Mr Fuller as a private citizen.
Which external agency looked at this and recommended that?
Well, I've spoken to the police, and I've actually got a brief on this, and I'm not going to go into those details. As I said, if you've got a question, you'll need to go to Mr Fuller as a private citizen.
Are you referring to the independent Deloitte review of the $3 million catering contract, which was awarded to Osmart Catering, owned by Mick Fuller's horse co-owner?
Well, as I've said, it's been looked at by an external agency, and I'll repeat it again. If you've got any questions, you'll need to go to Mr Fuller as a private citizen.
Do you know which external agency looked at that? Because that Deloitte review was not a comprehensive review of these allegations.
Well, I'm satisfied that the work that has been done by New South Wales Police, taking this to an external agency to ensure that it was looked at independently, has been done, and I'm happy with those actions. And as I said, if you've got any questions, you'll need to go to the individual as a private citizen.
Does Mick Fuller have your and the government's backing as a potential future board member of Racing New South Wales?
Well, I'm not going to comment on any board members because I haven't got any position there being put forward for consideration today. When we make board member decisions, that is a cabinet decision, and once they are appointed, then we actually release those names.
How long has the New South Wales government known, Premier, that Mick Fuller hadn't declared shares in racehorses, given this matter was raised in Parliament estimates last year?
The Deputy Premier has already answered these questions, and my understanding is that that may not be the case. So the Police Minister and the Deputy Premier receives advice from the New South Wales Police Force in relation to these matters, and I have complete confidence in the fact that they've been dealt with appropriately.
So you're saying
Has changed since we last spoke to you about the situation in Willoughby. Are you worried?
I'm still confident in that Tim Jones will be elected, as I've always said. The people of Willoughby always choose well. They've had their member go on to lead our party either in opposition at points in time and also being the Premier of the state. So, the count will take place, I think, over the next couple of weeks, and we'll wait and see.
You yourself have said...
Don't you, given the swing against the Liberals in
Well,
that seat?
well-
It should be a safe seat.
Well, as we know, when the former Premier Gladys Berejiklian was elected to the seat of Willoughby, I think she won it by around a couple of hundred votes. So by-elections are always difficult for governments. We all know that. What's most important is that we continue to deliver for the people of our state. That's exactly what we're doing. And I think you look at the announcement today, that's a great sign of confidence in where we sit today as a state. And we've been able to lead the way. Also, it was remiss of me not to thank Dan Andrews and the Victorian government. We've been working incredibly closely with them in relation to these restrictions that we've released today to get consistency as much as possible down the eastern seaboard. And I think it's another great example of two strong states, the two biggest states in this country, working together for consistency as we move through the pandemic.
Last question, a really big power station, can a really big battery honestly replace a power station? Because after the President's announcement this morning, there's already been a lot of criticism that it's not working.
Well, obviously it was disappointing, the announcement this morning in relation to the closure, but ultimately as well I have complete confidence in the establishment of the investment roadmap that we've set out when it comes to energy policy in our state, and I have full faith in the approach that we're taking. There's no doubt, not just here in New South Wales but around the country and around the world, we are transitioning from coal into more renewable forms of energy generation, and what comes along with that is different forms of transmission, and we've been ahead of the curve here in our state, and I have complete confidence in the roadmap that we put in a year or so ago, and the investments that we have made as a state to secure reliable energy, not just now but well into the future, and most importantly in a way that's affordable for families right across our state.
You yourself have said that you believe the local issues really dominate the by-elections. Looking at Willoughby, I mean, an independent who barely spent any money, campaigned for a couple of weeks, and really ran on one key issue, which was the Western Harbour Tunnel and Northern Beaches Link. Does that send a message to your government about what the community there really thinks about that project, and whether you should perhaps rethink it?
Well, I would say that when you're a government that's building a lot of infrastructure, there are difficulties and challenges that come with that. I certainly experienced that in former roles in relation to the construction of WestConnex, and we didn't always get things right in relation to that project. But the alternative is to not build and go backwards. That's the Labor way. Do nothing, build nothing, deliver nothing. And that's why they will always stand on the side with protesters, not on the side of progress. Well, I'm going to continue leading a government that gets on with the job and builds the projects that will transform people's lives, not just now and into the future. Having said that, including the beaches link, and having said that, that does not mean, I think the point in terms of the premise of your question, that does not mean that we can't improve the way we go about it. And I certainly think if we reflect on the construction of the WestConnex project, that during construction we could have done things better, particularly when it came to acquisitions, and we've learnt from that. And as a good government that's going to continue to build, I mean, we aren't stopping here. We are building right across this state. And whether it's the health minister in the construction of hospitals, there are things that we reflect on that could be improved. With school infrastructure, with road, with public transport. I mean, the light rail, mistakes were made there. You learn from it, you make adjustments, but you keep going. Now, what's very clear to me from Willoughby is that there's no doubt that that community in many ways doesn't get the benefit of that project and whilst at the same time having a lot of the inconvenience it's caused. So I accept that, appreciate that, and will work with the community in terms of how do we minimise disruption, not just during construction, but beyond. So that they're very important messages to take, and I accept that. But the alternative as well is to not build. We've seen Labor say they're not going to construct, because that's what you get from Labor. Do nothing, build nothing, don't offend anyone. I understand that works in the short term, but we've seen what the long-term consequences of the Labor approach is in New South Wales, and that's to go backwards. That's why when we came to government in 2011, we inherited a $35 billion infrastructure backlog. the hospital system, I'll talk about construction. The hospital system in this state is incredibly strong because of the hospitals we built since coming to office. I think it's 170 or 110. 170 hospitals and health facilities over 11 years, plus 110 currently underway and under construction. You've got to keep going, because the alternative is you stand still, and I look at Labor, they're the eternal custodians of the status quo. And what does that mean? You go backwards. And it also means that our kids and their kids will not have the quality of life that we have. So accept the feedback. We will ensure that as we continue to build a brighter future for our state, we take those messages on board. But I will also say we are completely committed to taking our state forward. And I know that there are inconveniences. There were inconveniences during the construction of the West Connects. But without it, Parramatta Road would be a car park. It was opposed by Labor every step of the way, just like they opposed the M2. Every project that we have built, they've stood in our way. We're taking our state forward. Tom.
Last one.
West Harbour Tunnel.
2 years ago, more than West Harbour Tunnel.
Yeah.
Financially viable unless raids, tolls on West Harbour Tunnel and the bridge. What's the government planning to do with those options?
Well, the first point I'd make is that accepts a premise on the financials. That's not the only focus of the government. The focus of this government is to build the roads so people can get to work quicker and home faster. That's what this is all about. Now, the Western Harbour Tunnel is a complex project. It's complex in the sense that by building it, you're also trying to minimise traffic congestion on other roads. Now, I have committed from the outset, when there's been any discussion in relation to the construction of the Western Harbour Tunnel, I have committed to being focused on putting downward pressure on household budgets whilst getting the construction of that tunnel completed. The government, despite what Transurban, I know that Chris Minns has his policies written by Transurban. That's not the New South Wales government approach. The New South Wales government considers all the advice we receive. So that's Transurban's view. There are multiple avenues that are under consideration and have been under consideration by the government in relation to the construction of the Western Harbour Tunnel. What I'm committed to is two things. One, building the tunnel, and two, ensuring that we're putting downward pressure on the cost of living, and particularly across our toll network right around Sydney. Now, there will always be different submissions. There will be different options provided to the government. I'll consider those, but what your readers need to know is that my focus is the construction of the tunnel in a way that doesn't put substantial increase on toll prices in Sydney. That's the commitment of this government. There are multiple options available to us. We will work through them. But Tom, what I'm not going to respond. Yeah, we know that. We know that one of those. Yes, there are numerous options. There are numerous options in relation to the tolling regime. But let us respond to at a point in time when we've made a decision. There will always be different. There will always be advice to government. I accept that, and I welcome that. But then it's ultimately up to the elected members of Parliament, of the government, of the executive, to make that decision. But once again, my message is. And what you'll see from Labor is a scare campaign, because this is what they do on every project we build. Every project we build. Now, we are going to construct that road and put downward pressure on toll prices.
But do you concede that it's almost inevitable that we'll get a two-way toll?
No, I don't.
Well, how are you going to have a two-way toll on the Western Harbour Tunnel, but not on the bridge?
I'm not going to give a running commentary in relation to the options the government is looking at. What I will say is that we will construct that road. You should be asking the Labor opposition, and a big call out to Lachlan Kennedy. Yes, so ask Labor, here's an opportunity today. Ask Labor, are they going to build, do they support the construction, well they won't have the opportunity, but do they support the construction of the Western Harbour Tunnel? We have said that we support the construction. I am saying there are multiple avenues available to the government in relation to the toll regime across Sydney, which we are considering right now.
So you can't rule it out.
Last question.
Well, we are currently considering all options available to the government. My message, as clear as possible, is that we are constructing the Western Harbour Tunnel, a tunnel that clearly Labor oppose, and we will be doing so in a way that puts downward pressure on toll prices across Sydney.
So the Parliament
drivers across the Sydney Harbour Bridge can't pay for the tunnel, or everyone does.
As I said, there are multiple options available to us. The government has not made a decision. Now, I'm happy for speculation to occur, and I accept that when you're constructing roads, there will always be views in relation to, oh, what does this mean? And that speculation can occur. I accept that. My job is to make sure I consider all the options that are available, and we will consider those and then make a decision. And I'll make a decision, and once I've made that decision, I look forward to sharing that with you and answering all the questions in respect of the regime that is in
Parliament
place.
spent a lot of money last year refurbishing the press conference room on level 6. Given the musical accompaniment, I think a press conference room would be more appropriate to use that press conference room in the future.
I think this is rather pleasant. I mean, this is the clock is chiming in celebration of the great day today in the lifting of restrictions, and I think it's wonderful out here. And I think we should have more press conferences in the Speakers Gallery. Thanks, everyone.